Good afternoon everyone. I am Dr. Gouri Priya, General Physician practicing at Chittoor at Ashraya Multi-Speciality Hospital, Andhra Pradesh. As a part of awareness program, today I want to enlighten the audience about the heart diseases in women. The heart diseases women are mostly neglected because women are the prime family, but they will be neglected according to they will look after their husband's health and they neglect their whole own health. The heart diseases in women are two types. It's coronary microvascular disease and also broken heart syndrome. This microvascular disease is nothing but narrowing of the arteries and which leads to heart attack in the general population. And the broken heart syndrome is the extreme emotional stress which the women feel whenever they lose the any family members, and it leads to the heart muscle failure. The cause of the heart diseases in women are mainly due to the hormonal changes in their bodies. The menopause is the condition where it is commonly seen in women at 45 to 55 years of age. During this menopause stage, the hormonal changes in the body are noted and there will be the changes in their physical metabolism and also the narrowing of the arteries in the coronary vascular system, and which leads to the coronary vascular disease and then heart attack. So the most of the women who presented with the heart failure changes are noted in the old age. But due to the lifestyle modifications and the recent women who are following non-healthy lifestyle, the heart attacks are also seen in the young population. 50% of women are neglecting their health. What is the causes of the heart attack in the women of the prime age? Mostly the gestational hypertension and gestational diabetes, which occur during the pregnancy, also play important role, which leads to the CVD, that is coronary vascular disease, in their later life. And the use of hormonal birth pills, that is to maintain the gap between the pregnancies and also to maintain any abnormal uterine problems, most of the women will be using the hormonal pills. These hormonal pills will changes their metabolism and also changes in the coronary vasculature, which leads to the obesity and also physiology of the coronary vasculature, and which leads to the heart attacks in their later life. And most of the term which we see nowadays is polycystic ovarian syndrome. This polycystic ovarian syndrome is mainly leads to early attainment of diabetic, and which leads to the heart attacks in their later life. So every woman should also get screened for their polycystic ovarian syndromes, and also they have to get the master health checkup from the age of 35 years. And I want to emphasize about the preventive modalities of the heart diseases. The preventive aspects are mainly quit smoking and maintain physical exercise, and also indirectly maintain their fitness and avoiding alcohol, eating healthy food, that is mainly fresh vegetables, fresh fruits, and also low calorie food and plenty of nuts in their diet. And what is the treatment of the heart attacks? The treatment of the heart attack is similar both in men and women. The heart attack is mainly whenever there is narrowing of the vessels, it leads to heart attack. This narrowing is mainly corrected with stenting, and also if there is more blocks in their coronary vasculature, it is corrected by bypass, that's called coronary bypass artery surgeries. The coronary bypass heart surgery is more complicated in women because they are obese and also they will neglect their health during the prime life, so which leads to the changes in their old age. So the healing of the healing process will be affected. So they will be having more complications compared to men. And also most of the women are thinking that whenever they are having symptoms, they think it as gastric upset. But the heart attack symptoms are similar both in men and women. It presents as pain in the left side of the chest, which radiates to the upper arm and also back of the shoulder, and sometimes the pain radiates to the jaw. Some women feel sweatings and some women feel lightheadedness, and they have episodes of vomitings and nausea also, and syncopal attacks are also seen in some women. But whenever they feel these symptoms, they think that it is mainly due to lack of intake of food and the gastric upset, and they will neglect to consult the doctors, and they will have a difficult situation, so that even doctors also cannot recover their life. So whenever I advise is, whenever the woman feels any symptoms, they have to consult the doctor, and first they have to rule out the condition, any whether it is affecting the heart or it is affecting the gastric system, and they have to get treatment accordingly. And I insist everyone to follow a healthy lifestyle, so that everyone will have a fruitful and healthy life in their later life.